4,500 nurses. Nurses everywhere are quitting. And I want to let you know this. There are other things that an RN can do with their license besides work at your hospital. You are not our only option anymore. And until you guys start appreciating your nursing staff, it's not going to get any better. And I know that you think that hiring contract nurses fixes the problem. It fixes it in the moment. Because I'm going to tell you something. I was a travel nurse before, and I can tell you that there is a hospital, when I didn't do it for that long, I didn't have that many contracts, but there's a hospital that I know that I would never go back to, and I did not recommend that hospital to other travel nurses. 7 patients, I know, may be the standard, and it may be what you can get away with legally, but it's not safe for our patients. You have nurses that are getting written up because a patient complains because a nurse didn't bring them a Coke. When actually she was next door performing CPR because one of her other patients coded. And you guys wrote her up. You guys have got to start understanding that nurses are human. And while every position is expendable, you're spending more money bringing on and hiring new nurses than you would trying to retain your current nurses that you already have. Nurses are struggling to make a living right now, and that's not right. And this is across the board. It's not just hospitals. It's hospitals, it is skilled nursing facilities and rehabs, and it's home health, and it's hospice. Because while all of you CEOs and hospital administrators are making 6 figures in bonuses, your nurses are struggling. Your nurses juggle more than just giving medications. Your nurses require to have a level of knowledge comparable to your physicians. And I know that you don't understand that, but we do. We catch the physician's mistakes before they hurt a patient. You want to write up a nurse when she has 8 or 9 patients because someone called out because they needed a mental break from you guys. That nurse makes a mistake and gives a wrong medication and she gets written up. You know, maybe your errors, your med errors, and all of your other mistakes wouldn't happen if your nurses had time to take a breath. When I graduated nursing school, I was making $21 an hour as a new grad. Now, granted, that was back in 2009, I believe. We are now in 2026, and nursing and healthcare in general has come a long way and is more advanced than it ever has been. Your RN should be making $80,000 a year, if not 6 figures. That is how hard they work. And it's not just what they do at the hospital. They lose time from their families and their children. They miss their children's birthdays. They miss family holidays. They miss weekend sports because of the way that you guys schedule. If you would lower the patient and nurse to patient ratio and pay your nurses what they are worth, and it's not just your nurses, your CNAs. Because I tell you, to do that job, you have to love other people and you have to want to be there and you have to be a caring person. But that doesn't give you the right to treat them like a piece of gum stuck to the bottom of your shoe. They also need a wage increase. Treat your nurses better. you CEOs are flying around in private planes, driving Maseratis and, boats and $1 million homes, and you give yourselves the bonuses every year, and you guys get raises every year. I'm an RN in the state of Florida. I didn't get a raise this year. And cost of living is higher than it's ever been right now. You have professionals out there working 2 and 3 jobs just to try to make ends meet. And that should not be the case for anyone working in healthcare. Just step back and take a look at the big picture. You spend thousands upon thousands of dollars on your lawn maintenance or your lawn designs. There's a hospital in Pensacola, Florida. They spend more money on their landscape than they do their own staff. How about you pay a couple of high school kids to go out there and mow the lawn and give your nurses a living wage to where they're not struggling? I don't think you guys understand the toll it takes on the mental health of your nurses. The death that they see, the injuries that they see, the family members that abuse them physically. You have nurses that are walking from your door to their vehicle in the parking lot, and one just got shot in the head and is now deceased. During hurricanes here in Florida, this was one of the reasons that I walked out. I had 3 minor children at the time. And yes, there was a hurricane coming. It was so bad that I needed to get my children out of the state, because I knew that once that hurricane came and went, there was going to be no electricity. There was going to be no running water. There were going to be no grocery stores to go buy anything from. So, at least not open anyway. So, they expected me to pack a suitcase, come to the hospital, and spend the night there. For however long it took, weeks. Hurricanes here do enough damage that cities don't often get back up and running for 3 or 4 weeks. And that's just your basic minimums. So they wanted my 3 young children to come to the hospital with me, and I just leave them in the cafeteria with hundreds of other people. No. I flat out told them, I have 3 minor children. I'm not coming in. Number one, they were not going to pay us. I know used to, a while back, they used to pay you your hourly wage from the time that you got there before the disaster until after you were released from the disaster. They would pay you your hourly rate. So whatever that was is what you made. Then it got to the point to where, no, we're not going to pay you that, but you have to be here at the hospital and you have to spend the night here for however long it takes. No, we are human beings. We are not robots. We have families. And yes, I'm ranting, but I am so sick of seeing colleagues quit the nursing field altogether. And I'm going to tell you what I'm doing right now. I currently work for the state, and I review medical documents. My knowledge is worth a lot to the state. I'm also studying to get my certified clinical documentation specialist certification, so that I can make 6 figures at home. And I don't have to worry about other nurses throwing me under the bus. And I don't have to worry about 9 patients when I can barely manage 6. I don't have to worry about having to start my shift with a narcotic count that is off because the nurse behind me or before me who gave me report also had a narcotic count that was off. You guys have got to get a grip. It's not all about you. It's supposed to be about that patient. Why don't you stop lining your own pocketbook and start taking care of your nurses, and maybe you won't have a 4,500 of them walk out. I will see you on the next one.